The goal for patients in the hospital is to get them medically stable and then discharge them to the next destination, whether that's home or rehab. So sometimes you only have like a day or two with a patient. Sometimes you might have, a week more sometimes. So it really varies. But the big role in acute care, I think, is really kind of jump starting their therapy journey. And so, you're like maybe the first person to mention it, but then as they go on, maybe to outpatient therapy, or maybe they're going to go to like an inpatient rehab program. Now with the electronic medical record system, most people, therapists can look at each other's notes. And so the therapist following you can kind of see that you started this education, and then hopefully in the continuum that education.
Welcome to the Health Coach OT, evidence-based coaching tips and resources for managing chronic disease and rehabilitation. I'm your host, Dr. Jacqueline Schwartz, occupational therapist, scientist, board-certified health coach, and educator. This is where we expand the traditional boundaries of rehab to address the root causes of chronic disease, where we build the evidence-based skills to address lifestyle factors like nutrition, physical activity, and more. Using an inclusive and intuitive lens, we meet people where they're at in their health journey to create lasting outcomes. Today, I'm thrilled to welcome Sonoe Oft to the show. Sonoe is an occupational therapist with over 12 years of experience specifically in acute care settings. She's known for her practical how-to tutorials to help new practitioners navigate the complexities of hospital-based therapy. Through her social media presence, Sonoe has created a roadmap that empowers new OTs to build confidence in acute care settings. Her passion for mentoring the next generation of therapists while maintaining clinical excellence makes her the perfect guide for today's topic. Sonoe, thank you so much for joining us today.
Thank you for having me. I'm excited to be here.
So I want to make sure that we're on the page, and we might have like new grad listeners or people who work in other areas of OT, but can you walk us through what a typical day looks like for an OT in acute care?
Sure. For me, typically a day starts at about 7:30. I get in, I load my patient list that's assigned to me. Depending on if it's my first day or not, it may take me up to an hour to do a chart review just because I want to make sure that I, comb through all the information and make sure that I have everything I need to know about the patient before I start to go see them. And then after doing my chart review, I'll kind of do a game plan of how I'm going to try and run my day as efficiently as possible, kind of going through higher priority patients, any new evaluations, anybody who's expected to discharge home, and then trying to clump those based on location. So seeing patients in a certain area before moving on to a different area of the hospital. And then depending on if I think the day is going to be crazy or I just feel some sort of way, I have a small ritual I like to do that's part of my self-care practice. So I like to start out with a small prayer that I send up asking for a calm heart and a clear mind, and then I dive into the day.
Yeah, that's so essential because when I practiced in acute care, I just remember running around all day. So it could be very hectic.
Yes.
So, can you tell me a little bit about the populations you serve and how chronic health conditions can lead to hospitalization?
Sure. So, working in the hospital, I have been a generalist for most of my career. So, you could see anything across the board. You see your neuro patients, you see your oncology patients, you see your med surg patients, which are your patients that have kind of those chronic conditions with a lot of different comorbidities. The chronic condition patients, in my opinion, sometimes are a little more complex to treat because there is so much to address. And then you're also working with people who have had these conditions for so long, opposed to, like, say, a stroke patient where it's like a new acute condition. And so it's like you have a lot more to address, a lot more education to do, a lot more trying to help them, like, create new patterns to try and maybe overcome some of those chronic conditions.
And so I'm thinking about evaluation now. So, um, in an evaluation, how might you know that somebody is going to have difficulty managing their chronic health condition?
You'll kind of get a lot of sense of that in your chart review to start. So if you do a thorough chart review, you kind of get a broad picture of understanding somebody's medical history. It'll often include how long somebody's been living with a certain condition. And then when you go to work with the patient and you do your interview of, asking them from their perspective, like, how much assistance are you requiring at home? What type of support do you typically need? You get kind of a better picture of what this person's life has been like and what the barriers may have been for a long time and helping them be successful in doing their daily activities. And so taking that approach, kind of starting to think of practical ways to help them maybe compensate for things that have been difficult for so long, gently approaching, the conversation about lifestyle changes that may help make a big impact in overcoming some of those chronic conditions.
Yeah, that makes a lot of sense. I like how you said gently approaching because that I feel like a lot of times people hear like you need to lose weight or you need to stop smoking, but what we know about changing health conditions is, shouting at people to stop smoking doesn't help them in fact stop smoking. So I like that. Is there anything in the chart review that like in terms of lab values or anything you might see like that would tip you off as to someone maybe doesn't have the best control of their chronic health condition?
Yeah, so I think lab values do tell you a lot. Like, with diabetic patients, you'll see, their glucose is maybe not controlled, or, like your chronic respiratory conditions, you might see that their arterial blood gas, readings are off. Certain things like that might kind of tip you off to chronic mismanagement of these chronic conditions.
Yeah, that makes sense. And it's so helpful as an OT, I think, to be able to look at the chart and really understand the lab values. And I think you have some resources on that, right?
I do,
Yeah.
yeah. So a big piece of kind of easing stress and anxiety for me has been compiling a lot of cheat sheets over the years that are quick references to kind of look at, because there is so much information to manage while you're working in acute care, and then knowing how to kind of interpret information and how to kind of understand the gray areas of that information. It can be a lot. And so having some cheat sheets has been helpful. And that's one of the big projects that I just completed is I put together a like comprehensive quick reference guide for acute care OTs.
Yeah, I wish I had that one. I was in acute care. So now I'm thinking about intervention. How do you incorporate lifestyle change into your interventions in acute care?
Sure. So interventions can kind of be all over the place in acute care. It just really kind of depends where you're meeting the patient. Some patients are so critically ill that the big part of your intervention is early mobility. If it's somebody who's coming in for like chronic condition, they're a frequent flyer. Those types of people, like a lot of the chronic condition patients, because they have so many readmissions, you start to kind of familiarize yourself with these patients, and you start to build a little bit more of a rapport with them. And the more rapport you have with them, the more appropriate it becomes to have kind of those harder conversations about, like, maybe we want to consider lifestyle change, maybe just making like one small change at a time to see how that affects, the condition that you're struggling with might be a good step to take. Because a lot of times people, because they're chronic, they've been dealing with it for so long, to tell them like, like the smoking example, like you need to just quit smoking. Like that is kind of a monumental thing to ask of somebody who's been doing it for years and years and years. So it might be a small step in like, hey, there's this great book that, gives information on how you could quit smoking. Like maybe you want to look into that. So starting to make small suggestions of small changes they can make towards the big change, and continuing to have that conversation with patients to kind of encourage them to make the changes that would help improve their quality of life.
And I know that sometimes people with chronic conditions will go into the hospital because of like an event related to their chronic condition, like a heart attack or a stroke. Do you find people who have had like severe consequence of their chronic condition in a different mindset about their willingness to change their behaviors, or you feel like it's the same?
I mean, I think it definitely, the patients you've had a major life event where it's really like, it's very possible that their life could have ended. I think that does give them a lot different perspective to where they might be more receptive to the suggestions that you're making and really start to, think more critically about how the choices they're making affect their life. I think when it's a chronic condition and they're coming in for, like shortness of breath or something, and then they get the intervention in the hospital and things improve, those types of situations, I think people maybe are not as like dramatically affected by it to think like, oh, I need to make this big change. Because in that frame, it's kind of like, oh, I have these smaller flare ups. I come into the hospital and then I'm better and then I can leave. So, yeah, I do think that, those big life events probably do make people more receptive.
Are you, and this was a debate we had when I worked in acute care. Are you picking up people, for example, with heart failure who, decompress, come into acute care, feel better, and then like are much better walking out? Or are they not as good of a candidate for therapy?
I think that's one of the gray areas, so that's one of the cheat sheets that I have put together because you are having to make kind of that call, like, is skilled OT intervention appropriate for this patient? So, you have to be able to show that they have the potential to progress with your intervention. They're demonstrating a true need for like a skilled licensed therapist. I think with those chronic conditions, it could go both ways, like depending on how you kind of critically think through it. So, is the education and intervention you're going to give actually going to progress the patient? Is it going to make a difference in improving their quality of life? If you think it is, after assessing the patient and talking with them, I think it is appropriate to work with those types of patients.
Yeah, that makes sense. I know the acute care setting is really fast paced and might present some unique challenges, but also opportunities for addressing these lifestyle factors. Can you tell us about some of the barriers that people might have to overcome if they wanted to address lifestyle factors in acute care?
I think sometimes it's difficult for people to make lifestyle changes if it's been a certain way for a long time. It's almost like you're asking their whole family to make the lifestyle change too, like if you take again the example of smoking and you're encouraging someone to smoke, but their partner smokes too. I think that's probably one of the biggest barriers is that certain lifestyle choices people have made, they're probably choices that people in their family are making too. So that makes it difficult for them to make that big change and then be around family that's continuing to choose the chronic poor choices.
And how long are you seeing people to be able to do intervention? Because I know lifestyle interventions could take a while to work.
Yeah, so it can really vary. Usually, the goal for patients in the hospital is to get them medically stable and then discharge them to the next destination, whether that's home or rehab. So sometimes you only have like a day or two with a patient. Sometimes you might have, a week more sometimes. So it really varies. But the big role in acute care, I think, is really kind of jump starting their therapy journey. And so, you're like maybe the first person to mention it, but then as they go on maybe to outpatient therapy, or maybe they're going to go to like an inpatient rehab program. Now with the electronic medical record system, most people, therapists can look at each other's notes. And so the therapist following you can kind of see that you started this education. And then hopefully in the continuum, that education continues.
And that's a good question. So how do you document, because I know in Epic there's like a lot of great click boxes for like level of assist for transfers and things like that. Are these type of evaluations and interventions like in the medical record, and how do you document them?
I think focusing more on like lifestyle and self-care is kind of a newer thing that has come to the forefront, which I think is great because I think it's important for anybody, not just patients. So there's not necessarily like a designated place in the electronic medical record system, but in all your notes, you have the opportunity to write a summary. And so that's kind of where I would put that type of information, the type of education that I provided to the patient.
That makes sense. And so we talked about how you see people for like a few days, but how much time do you think you're spending with each person like during a session?
That also wildly varies. That's one of the great things about acute care is it is so flexible. So because you're dealing with people who are typically not medically stable, you're able to spend whatever amount of time you think is appropriate with them. If you're playing the numbers game, you want to spend at least 15 minutes with the patient because there are productivity standards. But, you could be spending anywhere from like 15 minutes. I've done a treatment up to 2 hours in acute care, depending on is the patient tolerating what we're doing? Are they continuing to be receptive? Are they, able to still kind of absorb the education I'm giving and they're not getting overloaded? You're really gauging all of those things to kind of gauge how much time is appropriate to spend with a patient. And when you see that the patient is starting to fatigue or their ability to absorb information and education is starting to deteriorate, that's kind of where I usually end the treatment. And so it can really
Yeah,
vary.
that makes sense. One of the nice things about discussing lifestyle change is I feel like you could kind of add it in across your intervention. So, for example, if you're like working on standing balance and you have the person, you want them to stand for like a minute or 2 minutes, like you could have them standing and then doing education, or if they're taking a break. So it's not like you have to sit down and be like, let me tell you about smoking. You can kind of
Yeah.
put bits and pieces in and, like you were saying, like plant the seed so that way people think about it more in the future.
Yeah. Yeah, I think rest breaks are, a great time to like build rapport with your patient, ask them questions about themselves. They start to open up, and then that kind of opens up opportunity for you to share some things and education and things like that without it being so serious and stern, like you're saying, if we're like, okay, we're going to sit down and talk about this one thing.
Do you use any health coaching techniques like motivational interviewing or goal setting across your acute care interventions?
I do like to start my treatments with, I come in, I say like what my role is, kind of what the general plan is, but then I like to ask like, is there anything that you would like to focus on? Is there anything that you would like me to address? Do you have any questions on, kind of why you're here in the hospital and what OT's role is in your care? And then based on how they respond to that kind of drives like tailoring it to the patient to address exactly what they want to get out of your time together. As well as doing that, I feel like then they're more receptive to what you're offering because they've had the opportunity to kind of participate in planning what's going to happen in the session.
Yeah, that makes a lot of sense. So, for OTs who are looking to expand their acute care practice to include different lifestyle factors or just health and wellness in general, what small steps would you recommend for them to do?
Well, something that I wish I had done earlier on in my career is I think making that a priority for yourself as the therapist is, huge, and making you a better therapist to kind of provide that type of education because then you could share from your personal experience. A big thing that I didn't do earlier on in my career is that I didn't prioritize rest. Being new, I felt like I had to say yes to everything. Like I got to work overtime to get everybody's seen on my list. I need to work through my lunch, things like that, where I was really kind of on a path to burnout. And then I wasn't eating as well. I wasn't exercising. Everything kind of took a back burner to work, And so that took me a while to understand like, to be a good therapist and someone who can provide the best care, like you have to take care of yourself first. And that's by making good lifestyle choices, by prioritizing rest, prioritizing sleep, eating a well balanced diet, like prioritizing exercise, like doing things that really feed your soul and calm your nervous system. I think by doing that, doing those things yourself makes you a better therapist to be able to educate your patient on those things and how those things do benefit your quality of life.
I definitely agree. Like, I remember there were days where I just like didn't go to the bathroom all day because I didn't have time, but I'm like a much better
Yeah.
therapist when I take a 5 minute bathroom break.
Yeah, right.
Are there any
Mhm.
continuing education resources that you found helpful for people in acute care who also want to address lifestyle factors?
I don't know that there's like a specific continuing ed course I've taken that's geared towards acute care in that sense of like, healthy lifestyle, self-care, things like that. It's been more through like personal reading self-help books, learning more about nutrition, learning more about how those things impact your well-being overall, and just kind of having that knowledge in the back of my head to kind of incorporate more into the hospital setting. That's something that I think just overall I've noticed working in acute care is a lot of the life skills you pick up kind of apply to acute care. Like the whole healthy lifestyle type thing, I think comes in to be valuable. I used to work as a server, which is just kind of digressing, but taking that into account of like being able to multitask, shift gears quickly, handle a lot of stress at once in a fast-paced environment, that all kind of translated into being able to work in acute care. So I think just your whole life of different things you learn, I think come in to be valuable in some aspect because you are treating so many different kinds of patients with so many different kind of issues that your life experiences overall, I think, serve some type of purpose in your acute care practice.
That's definitely one thing I learned as a new grad is talking to people and like having conversation and being personable is a real skill that is undervalued.
Yeah. Yeah. And I think, when people are in the hospital, something has happened where it's traumatic, and being able to connect with people on some level, I think makes a huge difference in the patient's care. And I think being able to do that makes you feel like a safe person. So they feel like, oh, this person is here to help me. And likely they're more receptive to what you're trying to provide them with education.
Yeah, it's easy, I think, for people to like feel like a number when, you just have random people coming in, like mopping the floors, and then people just coming in and like randomly scanning stuff and not saying anything and then leaving.
Right.
So I do
Yeah.
think people appreciate when you could come in and like actually talk to them and treat them like a real person.
Yeah, absolutely.
And it's also nice because I think we're one of the few practitioners who can actually spend time with people if they need it versus the nurses where they're like juggling 4 different people or whatnot.
Yeah, and I think that is one of the beauties of acute care is you do have so much time freedom. Like, yes, you have productivity standards and you have things that need to get done, but you do have the freedom to sit and listen to somebody if, your patient opens up and they're starting to share something emotional and big with you. You're not like, I gotta go, I got a med pass or something like that. You do have that flexibility to stay and give the patient the time they need.
That sounds great. So, for listeners who want to learn more about acute care or connect with you, where could they find you and your tutorials and resources?
Yeah, so I'm on Instagram as well as TikTok. You can find me at OT Roadmap. You can also find information about the OT Roadmap guide that I just put out there also. It's a quick reference guide that helps acute care OTs navigate with confidence. And then I also have the OT Roadmap community where that's a place that it's a community that you can learn and grow with. That's where you'll have access to have me as a coach in your pocket. You can send me message any time of day, any questions, any challenges I can help you through.
That sounds amazing, especially because in acute care, sometimes there's a therapist nearby that can help you, but so often, like, you're the only OT for like this floor, and the next OT is like, 5-10 minutes away in a different section of the hospital, and you have no idea where they are.
Yeah, right. Yeah, there's been times too where I was the only OT in the hospital, and I'm like, oh no.
Yeah. The holidays, that's the one, not great thing about acute care is there's a decent number of
Right.
holidays and weekends sometimes.
Yes, yep. The hospital never
No,
sleeps.
well, thank you
Yeah.
so much for joining us today. We really appreciate you sharing your expertise and insights.
Well, thank you so much for having me.
That's all for this episode of the Health Coach OT, evidence based coaching tips and resources for managing chronic disease. Thank you for listening. If you found today's discussion valuable, please subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts and leave us a review. For free resources, visit healthcoachot.com and join our newsletter for weekly insights and updates. Until next time.